I have a Bachelor's of Science in Education. I was originally a math teacher. I found out that related to politics, the politics of the system, I didn't want to do that. I wanted to do something where I could actually make a difference, and where I wasn't as hampered by the system that I was working in. That led me on a sort of a long journey, and I eventually wound up going to chiropractic college. I am very happy with the profession that I have chosen. I am a doctor, Dr. Timothy Cooper. Medical doctors and chiropractors, we both have to go through a rigorous 5 academic year program, doctor program first. And the content of the programs are different, of course. The medical doctors will focus on pharmaceuticals, surgery, that sort of thing. As chiropractors, we don't do that, but we spend that same time in that same coursework focusing on biomechanics, neurology, orthopedic testing, chiropractic treatment, of course, that sort of thing. And in fact, it was Thomas Edison who said that the doctor of the future will give no medicine, but will instead interest his patients in the care of the human frame, in proper diet, and in the cause and prevention of disease. And that's pretty much in a nutshell what chiropractors do. A chiropractor is a neuromusculoskeletal expert. We deal with the nervous system, we deal with the muscles, we deal with the joints, especially the spine of the human body, as most people know. We do everything that we do without drugs, without surgery, and that's kind of the hallmark of chiropractic, being able to treat naturally and effectively without resorting to the much more aggressive techniques. There is the misconception that all chiropractors do is crack backs. I guess sometimes you could describe what I do as cracking backs. That's certainly not all I do, but first thing I want to say is among chiropractors we have a very good saying, don't get addicted to crack. And the reason we say that is because with the adjustment there is not always the audible cavitation sound, the crack, if you will. An adjustment can be successful and the joints can be mobilized and proper function can be restored without the audible crack. Also, we don't just confine ourselves to backs. Yes, we do deal with the spine, that is a very large part of what we do, but we also deal with the upper extremity, we deal with the lower extremities, we deal with ribs, we deal with the jaw joint, feet. If it's a joint, we deal with it. You should consider seeing a chiropractor if you have back pain, neck pain, headaches, tendonitis, bursitis, plantar fasciitis, if you have knee problems, if you have shoulder problems, if you have a spine that you want to keep healthy or get healthy if it's not already there. Interesting point, the American Medical Association, they recommend trying conservative care before trying surgery. You can look that up for yourselves. We'll provide the link for that. The Social Security Administration, they estimate that 1 in 4 of all 20-year-olds, so this is 25%, will be disabled by retirement. If you look on WebMD, they put that figure at 1 in 3. That's kind of scary. On top of that, WebMD also lists the top 2 causes of disability as arthritis and back pain. These are things that chiropractors deal with every single day. Nearly half of all injured workers, this is another relating to the disability, nearly half of every injured worker who consults a surgeon first, they wind up getting surgery. Statistics find that if you consult a chiropractor first, it's less than 2%. So in general, chiropractors assess the spine. We look for problems related to posture, related to movement patterns, motion. We look at the neurology involved. We make corrections where needed. There's a lot of variety within chiropractic. There's actually a joke among chiropractors that if you see 3 different chiropractors, you'll be adjusted 4 different ways. And that's kind of the great thing about chiropractic. There is so much variety, which means that in general, there's a chiropractor who is perfect for you, for your condition, or conditions, as the case may be. Some chiropractors focus on neurology, some focus on the muscular system, some focus on nutrition, some focus on overall health and wellness. And of course, there are chiropractors who just want to get people out of pain and get them moving again. So we all do a lot of very different things. The important place to start is to ask yourself, what are you looking for? And look for somebody who matches that really well. Chiropractic is very cost effective. There is a well-known report called the Mango Report. This was done in It was a large data study done in Ontario, Canada, the province of Ontario. And the report studied the efficacy of chiropractic, the long-term results, the cost effectiveness, and so on. And they found that chiropractic, if it was fully funded by the government, and remember in Canada they have a national healthcare system. It's paid for through the taxes. It takes care of all the people in the system. If that was fully funded by the government, it would save the system hundreds of millions of dollars every year. So chiropractic is cost effective from the perspective of the payer, whether the government or health insurance care. It's also cost effective from the perspective of the individual patient. If you undergo chiropractic care, statistically, you will have less hospitalizations, less surgeries, you'll have less traumatic injuries, and so of course your own cost for dealing with those things is substantially lower, even after the cost of paying for chiropractic care yourself. You can get a hip replacement, you can get a knee replacement. There is no such thing as a spine replacement. It's your call. I recommend yes. I recognize that I am a chiropractor. In my opinion, yes. Everybody should see a chiropractor, even if it's just for routine health care once a month, something like that. If you have active problems or other health challenges, you'll want to see a chiropractor more often.